And medications like Ozempic, Wegovy, Mounjaro, they're in short supply right now due to this new weight loss craze. But are they safe? Who should use them? Who shouldn't use them? Joining me now with those answers, clinical pharmacy specialist Neha Agrawal with Legacy Community Health. Good morning.
Good morning. Good morning.
So let's answer that right off the bat. Who should be taking these medications? Who should be avoiding these medications? Do you like them?
Okay, for patients with diabetes, no brainer. These medications have fantastic A1C reduction. We're able to get patients off of insulin. The results have been great. They also have excellent cardiovascular outcomes for patients with diabetes, lowering the risk of heart attack and stroke. Patients who have history of thyroid cancer or family history of thyroid cancer, pancreatic cancer, and already have a slow digestion, I would not recommend these medications for them. Now, for weight loss, we really do need to weigh the risks versus the benefits. If your weight is leading to health complications such as sleep apnea, hormone imbalances like polycystic ovarian syndrome, fatty liver disease, or debilitating osteoarthritis, then yes, there is an avenue for these medications. However, if you are looking for that quick 15 to 20 pound weight loss or for aesthetics, then no, I would not recommend these medications.
Yeah, so overall, they're having huge success in people. But the idea is if you're somebody who's battled obesity your whole life, this is something that could help you, and it could help you long term. Again, though, you might have to be on this long term. So like you're saying, if you're looking for quick weight loss, this isn't for you. You'll just gain the weight back, right?
Correct. What the drug companies are not telling everybody is that they have no intention of getting patients off of these medications.
Right.
This is a long-term commitment. And if you miss a dose, or if you're not able to get your supply from, because there are still supply issues, as you just mentioned, that food noise comes back. That feeling of fullness disappears without these medications. And so it is a long-term commitment.
Yeah, and I think because of that long-term commitment, I'm seeing more and more insurance companies say they're not going to pay for it. So now people are looking at $1,000 to $1,400 a month to pay for these drugs. So it's not really affordable. How could people get these drugs if they need them, and now insurance won't cover it?
Correct. And that's what we're running into. That's what we're seeing, is that they are paying for diabetics, for patients with diabetes. They will pay for it. And before, there was even a little bit more wiggle room where they would pay for patients that had pre-diabetes, but it's clamping down, and the insurance companies are really not paying for weight loss. And if they do, it's with a really high premium or multiple rounds of prior authorization. So it's very costly. And this is a medication where the drug companies have no intention of taking you off. You're looking at $1,000 to $1,500 a month out of pocket.
Yeah, so are you seeing people misuse these medications? What are you thinking about the faux Ozempic that's out there?
Yes, and so that's my concern, is that counterfeit Ozempic is popping up. And so please don't get swayed by those advertisements online. There have been some bad adverse events with those counterfeit Ozempics. The FDA has put out warnings against them. So if you are looking at Ozempic, make sure that it's coming from a state licensed authorized pharmacy.
All right, all good information. We're definitely going to be talking about this well into January. Neha Agrawal, thank you so much for talking to us this morning. We appreciate it.
Thank you so much.